welcome to Resilient Now podcast. We're really happy you're here. If you are going through anything or just stuck in a problem or an issue, my job is to try to find you a speaker who is on the other side of that situation. We are, one day at a time trying to find people that have been through things, resilient stories, and they're on the other side. And hopefully you'll find yours if you go to my website, Resilient Now Podcast .com. You will see a lot of speakers there. You can also listen to this on Apple. I have a show and on Spotify and on YouTube. So I'm excited. I'm going to introduce Beth in a second, but she came to me by a referral and I got to meet her briefly once. I'm super excited. She has a resilient story that I think is going to touch many people and hopefully, help people move forward. So I want to ask Beth, first of all, I want to welcome her. Welcome Beth to Resilient Now podcast.
Thank you, Liliana. I'm happy to be here. Thank you for the opportunity.
Yes, thank you. And so the first thing I usually ask guests is, what does resilient now mean to you?
It means bouncing back and being in the moment by actually living your life instead of freezing.
Thank you. Thank you. So Beth is going to talk about, she is a cancer survivor, so she's going to talk about that. And I don't want to waste any more time. I just want to give you the floor and thank you so much for being here. And, you're on.
Thank you. Life is so full of ironies, and breast cancer was honestly the last thing I ever thought that I would experience in my own body. I grew up with it all around me. I always felt that by the time I was old enough to be concerned about it, that science would know so much more, and part of that was true. But I always felt like if I took care of myself and took care of my body, that I wouldn't get cancer. So, um, just a little family history. There's cancer on my mother's side of our family going back 9 generations. Every woman except my mom and her cousin had died of breast cancer. So um, I felt like I knew a lot about it. And I found out there was so much more to know. And I was very fortunate because of my family history. I had a doctor that I knew and that knew my body well. And by the by the time I went to her, she didn't accept my insurance anymore. Her circumstances had changed. So I made the choice to go to her for second opinions every time I went to my insurance doctor. And it is amazing when you have a doctor that takes care of you like your family, like you're their daughter or sister or family member of any kind. And I was blessed with that. This particular doctor had written a book, and she explained to me that I had choices and that I didn't have to go traditional Western medicine route strictly or otherwise. And she opened my mind up. So I read her book twice in 2 weeks, and it was during the pandemic. So I took a very deep dive and had the time to do so. And I learned what type of cancer I had because there's so many breast cancers. I learned what was feeding it, and then I learned how to alter my lifestyle, which is called a lifestyle approach, in such a way that I could stop feeding my cancer and flush it from my body. So
Wow.
it was really, it sounds like a lot, and I guess it's kind of radical to some people, but it was absolutely the road for me to go. Um, so while I continued seeing traditional Western medicine doctors, I overnight I went off of bioidentical hormones. I didn't have any sugar. I didn't have any alcohol, and I went vegan.
Mm.
And I added fasting. So every other week, I did a fasting replicating protocol that's specially made for people with cancer. And it tricks your body into thinking you're 100% fasting.
Mm.
Yet it gives you nutrition so that you don't um, lose weight and render your body um, other challenges to try and be strong. So
Mhm.
I don't know if that makes sense, but losing a lot of weight when you have cancer is not a good thing. And I wasn't, that wasn't part of my symptoms. So I did this 5 times. And when I went back for a follow-up radiology appointment for an ultrasound, the radiologist said to me that it had the cancer, the size had not changed at all, that it
Mhm.
had not grown and it had not shrunken. So I drove home thinking, okay, well, I guess I'm having surgery. So I scheduled surgery and it went very well. The doctors had decided to do a reduction on the side that I did not have cancer so that
Mhm.
um, in between surgeries, I would at least um, fill out my clothes in an even way. So I was supposed to have 3 surgeries. The first taking out the cancer and the reduction. The second would be full mastectomy to place spacers. And then the third would have been for implants that
Mm.
was going to choose. So after the first surgery, 2 days later, or 2 weeks later, I went into my doctor to get a pathology report. And she had postponed me by a day, which was kind of unnerving. So
Mhm.
she walked in the door. She said, I postponed you because I took your chart to the board and I put it on the table and asked all my colleagues, tell me I'm not crazy. And I was a little confused. And she said, what I'm telling you is what you did worked. And when we did surgery, you no longer had cancer.
Oh my God.
So, I was obviously elated. And she said that they felt that I could stop there and I didn't need to have the other 2 surgeries, which I chose to do. And then as I started telling the story to people, a few people asked me, well, aren't you angry? And I said, angry about what? And they said, well, you had surgery when you didn't have cancer anymore. Like you changed your body and
Mhm.
you didn't have to do that. And my response has always been, I feel like I went through that for a reason. And now I'm walking, living proof that the lifestyle approach does work and that we don't have to always cut up our bodies to help ourselves and to make a course correction inside of ourselves.
That's an amazing story. What kind of cancer was it specifically? Do you remember?
So um, it was in situ. So in I should have looked this up to refresh. I'm sorry,
That's
um,
okay.
but it was progesterone and estrogen 98% positive. So that's part of why I was able to stop with the sugar and stop with any type of hormones and then use the fasting to flush my body after that. So
That's amazing. So it was definitely so it was breast cancer is where it was situated, correct?
yes.
Yeah. Oh my God, this is a miracle. It's like amazing that you did this. And how do you feel today? How do you feel?
I feel great. I'm in the middle of my fourth year, cancer free, and um, I I feel blessed and grateful. I feel that when we go through things in life, for me, I feel a responsibility to share with others who are going through it
Mhm.
how I made it through. And I think that's part of the purpose of, going through the things we do and actually making it through so that we can share things with others and open people's minds and hearts and hopefully, empower people to help themselves.
Thank you so much for sharing that. So you still follow that protocol? You're still doing, you or have
I
you you don't do that anymore?
I so a few months, about 6 months after surgery, I didn't feel fully recovered energetically. And so
Mhm.
at a post-cancer weekend retreat, and the nutritionist explained to me that with my blood type, I needed to have animal protein. So I added fish, and I'm quite comfortable with that. I feel like I get enough protein from that. And every now and then, I'll decide to have a glass of wine. I,
Mhm.
I watch the amount of sugar that I eat,
Okay.
and I can tell when I'm having too much sugar because I can actually feel inflammation going on.
Right. Yeah.
So I'm not as strict as I was, but I definitely feel better doing all that cleansing. And I honestly thought I was going to be doing the fasting every now and then, but I haven't felt the need. So I'm much more in tune with my body.
Yeah, that's what I was going to say. You're listening to your body and it's telling you what to do.
Yeah.
So this is amazing. Thank you for sharing that. And I know you just went through some things and you are a very resilient woman. So, thank you for sharing this story. I always finish the podcast with a gratitude because I really believe gratitude can trump almost anything, sadness and resentment and just everything. So what's your top gratitude right now? If you had to say one or two.
Being here, living my life and enjoying the phase of life that I'm in with my family expanding. I have grandchildren now, and I'm living life, I think, through a different lens,
Mm.
more through
Oh,
my
wow.
than through my head.
Yay, that's awesome. It's like you got a second chance. You can do it differently and you can be more open to things. Anyway, this is a beautiful story. Thank you for sharing. You are a survivor, you are resilient. And anyway, so everybody, please keep coming back. There's a lot of, be different kind of speakers and like beautiful Beth here. And, hopefully you'll hear your story and remember to stay resilient now. Thank you, Beth. You're the best.
Thank
Thank
you.
you. Bye bye, everybody.